Good morning. My name is Margaret Lubwama. I'm a PhD research fellow with the UCI Fred Hutch D43 grant. So just a bit of my path to the D43. I completed MBCHB at Macquarie in 2010. I graduated in January 2010. I worked for a year in a private hospital, and then I pursued Masters of Medicine in Medical Microbiology in 2011. And I graduated in January 2015. For my master's specifically, my thesis was Bacteremia in Febrile Cancer Patients in Uganda, and that laid the foundation for what my PhD studies are about. We got some preliminary findings which we have recently published, and that gave birth to the PhD. And I learned about the D43 through meeting with my main mentor here in Uganda, Warren Phipps, and I was selected for a PhD under the D43 grant. So I had an opportunity through this grant to go to Seattle for a year. I actually spent there 9 months, and that was at the Fred Hutchinson Cancer Research Center and the Seattle Cancer Care Alliance, which includes the Seattle Children's. And for my stay there through this grant, I was able to attend EPI and biostat classes, develop my PhD protocol, which was the main reason that I went there, and also received mentorship under some of the faculty at the Fred Hutch. And at the Seattle Children's and the Seattle Cancer Care Alliance outpatients, I was able to do some observerships in the infection prevention and control programs and their antimicrobial stewardship programs, which was good because it gave us ideas for what we can do at the Uganda Cancer Institute concerning infections in cancer patients. So coming back to Uganda after that period, that's when I started the PhD, and through the time here we've been able to do different programs like the Research in Progress, which have helped us keep our research up to date with each other. And then something that I'd never seen before is the peer mentoring, where you have different researchers coming together and mentoring each other, as opposed to the senior-junior mentorship, which was very good. And of course, my mentorship with the different collaborators of the UCI Fred Hutch picked up again here at Uganda. And something that's very interesting for us is that we were able to launch the antimicrobial stewardship program at the Uganda Cancer Institute based on the findings that we got from my PhD study. So my PhD really is about bacteremia in hematologic cancer patients with febrile neutropenia in Uganda. Why we focused on hematologic cancer patients is, as I mentioned, my master's study showed that we do have challenges with the patients that have hematologic cancers and are febrile neutropenic. Not to mention that not to say that the patients with solid tumors don't have problems, but this was where we decided to start, put our focus first. And the main objective really is we're looking at the risk factors, outcomes, and antimicrobial susceptibility profiles of bacteria associated with bacteremia in these particular patients. So far we've been able to enroll 351 patients with hematologic malignancies. This is from January 2018. And almost a third of those have at least one febrile neutropenic episode. And more than a third of those have a positive blood culture. So that is a real challenge for them. And among the risk factors, our main risk factor was mucositis, which is not surprising in these particular patients given their chemotherapy. And also we noticed that patients with bacteremia had a low ANC, absolute neutrophil count, compared to patients with no bacteremia. Interestingly, in our study, we found that many of the patients at the UCI have an unknown HIV status. And that is something that we have brought up to the attention of the UCI administration, and we're seeing how this can be bridged so that we can actually have patients tested for their HIV, as that affects the cancer chemotherapy that they receive. So most of the participants that develop a febrile neutropenia are those with leukemias, and AML patients have a higher chance of developing a bacteremia compared to ALL patients. Significantly in our setting, at the Uganda Cancer Institute, we have most of the organisms being gram-negative, with E. coli and Klebsiella pneumoniae being the major culprits. And interestingly, up to 61% of the organisms demonstrate the ESBL phenotype. We looked at some of the genes for ESBL, including CTXM, TEM, and SHV, and 41 out of 76 had the ESBL genotype, of which most of the organisms had the CTXM. And of the CTXM, most of those are CTXM15, which is something that's worldwide, and we're not surprised that we're seeing this. And we know that the treatment of choice for these patients is the carbapenem, but at the UCI we found that up to 24% of the organisms are carbapenem resistant. So that is something that is quite challenging. Looking at the gram-negative organisms, the gram-positive organisms, most of them are Enterococcus species, of which 45% are vancomycin resistant. So the number is small, 11, but that still tells us much of what we're dealing with. In terms of mortality, looking at survival, definitely the survival for bacteremic patients is poorer than the survival for patients with no bacteremia. So looking at the outputs through this D43 grant, we've been able to attend some conferences within Uganda and regionally and also internationally, and we're going to present this work at the ID Week and the Aortic and the ASTHM, which is a larger platform and will give us larger views concerning this particular study. And as I mentioned, we published the master's work, and we're writing manuscripts to publish the PhD work. For future directions, we're looking at, I've mentioned the conference presentations, and we want to sequence these organisms just so that we can find out, are they related? Are we dealing with outbreaks? And also, I did not mention, part of the study is collecting extra blood. We want to determine if there are other causes of bacteremia that we probably could not detect with our methods, or we probably missed in this particular cohort. Of course, we want to complete the analysis of the study cohort that we have, and then I'm planning to submit for K43 Career Development Grant, which is currently supported, the application process will be supported by the recent renewal of the UCI Fred Hatch D43 grant. And I'd like to acknowledge my PhD committee members, supervisors, and mentors, as well as the granting that I've had. The previous speaker had mentioned the issue of the D43 having a limited amount of grant monies for research for the students. So through the D43, again, I've been able to learn some grant writing skills, and we're able to apply for more funding for this particular study at the SEN and the UCI ADB. Thank you.